Friends, welcome to SafeBay. Today we are going to see the role and responsibility of employer, employee and the government agencies with reference to International Labour Organization's tools and its applicability during this present pandemic COVID-19 in Indian factories. Before that, I would like to say that the Indian tools will be taken up at a later date because as per a media report, a petitioner filed a case before the Honorable Supreme Court of India. The petitioner says that recent changes, modifications in labor laws, including suspension of health and safe working provisions by many state governments, leads to unfair labor practice. The petitioner has made about 10 state governments as respondent parties. Therefore, it may be prejudiced to discuss the applicability of Indian laws. That is why we will wait and take up Indian tools at a later date. Now, we will move to International Labour Organization's tools. They could be broadly classified into ILO Convention and ILO recommendations. The ILO conventions are to be compulsorily ratified by the member countries, and ILO recommendations need not be compulsorily ratified by the member countries, and it is only a non-binding guidelines. I will bring out few conventions and recommendations briefly with reference to COVID-19 for our discussion here. The Occupational Safety and Health Convention number 155 requires all employers to take practicable preventive and protective measures to minimize occupational risk. So, in my opinion, this puts the onus on the employers to track any COVID illness confirmed to have occurred in the workplace after the job carried out, or contracted as a result of employment, or contracted from outside the factory premises but failed to detect its spread or failed to detect its entry into the workplace. Such cases must be recorded provided it involves medical treatment beyond first aid or days away from the work. However, I see a catch here. In view of the present nature of pandemic spread, varying pattern of virus from country to country, it will be definitely difficult for the employers in various countries, including India, to track its spread into their workplace or to prove that the virus has spread out of the or virus has been generated out of the employment. But outside employers connected with healthcare, emergency response and related other agencies are expected to maintain suitable records in this regard. Here, a case study is coming to my mind. During this COVID-19 period, 2 workers of a particular section in a food processing industry, a continuously running industry, since it is a food processing industry, it is also an essential industry. 2 workers when tested positive in a particular section, the other workers of that section have refused to continue with their work. The management was put into a lot of inconvenience and they were taken by surprise. Here I could see that the persons affected by the COVID-19 might have had certain symptoms or might not have had certain symptoms, because that is the pattern emerging in certain parts of the country in India. Therefore, it has become very difficult for the employer to identify such people who are carrying the virus but attending to the workplace. However, the employers are required to be very cautious and screen the workers before they enter their workplace on day-to-day basis. My dear viewers, the views and opinions expressed here are mine, and listeners are requested to verify the correctness before use, though every care has been taken to avoid errors and omission. Thank you for listening.